Good evening, everybody. My name is Jackie Boychuk, and I am the Marketing and Communications Manager at the Canadian Kennel Club. It is my pleasure tonight to welcome all of you. So on behalf of CKC and Purina Pro Plan, for all of our CKC and Purina Pro Club members, welcome to our webinar tonight on preparing for canine pregnancy. For those who may not be familiar with our speaker tonight, we have Dr. Marty Greer with us. Dr. Greer is a renowned veterinarian and lawyer whose life work has been dedicated to improving the health and well-being of pets. Dr. Greer has been breeding Pembroke Welsh Corgis since 1990 and Danish Swedish farm dogs since 2005. She has extensive experience in breeding and raising show dogs and has written a book called Canine Reproduction and Neonatology, if I pronounced that correctly, a practical guide for veterinarians, veterinary staff, and breeders. She also recently wrote a book, Your Pandemic Puppy, in 2020. I personally am very excited to welcome Dr. Greer tonight. I've been listening to her for a few months now as a guest on the Pure Dog Talk podcast while I walk my own dogs. And her approach to these very complex and sometimes tricky subjects is fantastic. So everybody buckle up. But before we get started, a few housekeeping items. So Dr. Greer's presentation tonight will be about 1 hour. We'll have a quick message from our sponsor, and then we'll take a 5-minute break. Following that, when we come back, then we will have our question and answer period. We are a big group today. There's almost about 350 of us, which means we are going to keep everybody on mute during the presentation. And you can put your questions into the Q&A feature at the bottom of your screen. I mentioned it earlier, it kind of looks like two little text boxes on top of each other. And then we will get to as many questions as we can during the Q&A period. Dr. Greer today would also like to ask everyone to please keep your questions to general topics she'll be talking about today versus questions that are very specific to your dogs or your particular breeding program. She'd be happy to take those specific questions after the presentation via email. So let's try and keep our questions general and to the topic she's going to discuss. We are also recording tonight's webinar and it will be made available to everyone afterwards. So don't stress too much about trying to write down every single detail. And on that note, I'm going to turn the mic over to Dr. Greer.
So thanks everybody for being here. This is a great attendance, a great group, and I'm excited to be here. We were planning some travel into Canada until COVID happened. So hopefully once things settle down, we'll be able to get back on the road again and start visiting some of you. We're not that far from Canada, so I really look forward to that. So we're going to talk tonight about pregnancy and preparing for the pregnancy. And what I want to start off with is the basic premise that breeding is a luxury of the body. It's not a guarantee that just because you put part A into slot B that you're going to end up with a litter of puppies. And it's really important to remember that the body functions as a whole unit, and the pregnancy part of it, producing sperm, producing eggs, managing a pregnancy, is frankly not a priority for the body to manage. You've got to keep your brain, your heart, your lungs, your liver, your kidneys, all your major organs working first. So if we don't have great health and great metabolic support for the whole body, our dogs aren't going to have the success with producing sperm, producing eggs, and producing puppies that we would like. So we need to start off keeping that really as a thought to have in the forefront. So hopefully, even though this is the after dinner presentation, you'll make it through without falling asleep. This is one of my Corgi puppies, and this is not the only picture that I have of a Corgi puppy sleeping in the bowl. Clearly, this one was going to make sure that he did not miss the next meal. So hopefully we'll be able to get through tonight's presentation without anybody really nodding off. So my questions for you are going to start off with the questions of, can you whelp and raise 100% of your puppies? And I'm going to venture to say that very few people on the call tonight have had 100% success in raising litters. Along the way, we tend to lose puppies, and so it's important that we get our bitches off to a good start and that we are successful delivering the puppies and getting everybody up and running so that we have 100% success or as close to that as we can. And my next challenge for you is whether you can prevent diarrhea in your puppies. And we're going to talk about these things tonight. So if you have shaken your head no to 100% of your puppies or no diarrhea, then there is going to be something in tonight's presentation that you'll be able to take home. And as soon as you have your next litter or your next planned litter, we can start getting things going for you. So I'm going to hopefully get some things for you tonight that are helpful to you, really practical, really hands-on, really the first thing that you can do to make a difference in your breeding program. So I do cover a lot of material, and I do tend to cover a lot of material fairly quickly, and it's fairly dense material. So like she said earlier, it's going to be recorded. Don't worry if you've missed something, you can go back and listen to it or watch it again so that you have a chance to catch some of the details. So try not to focus so much on the details that you lose the whole presentation's emphasis, which is really successfully breeding your bitches. So the topics we're going to cover tonight are going to be before and between breedings, so body condition scores, puppy and performance diets, folic acid, DHA, raw meat, how that influences the presence of bacteria and parasites in our bitches, the intake of carbohydrates, the importance of peas and legumes in our bitches' nutrition, health screening and preventives, health preventives for heartworm, flea, and tick. And then we're going to also talk about ovulation timing, uterine health, pregnancy, feeding and parasite control, and not to be left out, the boys, because without the boys, we aren't going to have a pregnancy. So before the breeding, you need to start making plans long in advance so that you're well prepared for what's going to happen. I do want to talk first and foremost about body condition score, because it's really important that before we breed our bitches that they are at ideal body condition or maybe just a wee bit on the heavy side. Now, this is a dog that actually presented at our practice. This isn't from the internet. This is a dog that was actually in my practice for a C-section. And as you can see, she's really distended from the pregnancy. But if you look across her back, you can see that she's got her vertebrae are showing. You can see those little bumps along her back where she is clearly not carrying enough body fat to support the pregnancy that she is carrying and the extra fluid that's associated with this particular pregnancy. So I think it's really important that we keep our bitches at an ideal body condition. Some of us with performance dogs or show dogs, competition dogs, are going to have them a little on the lean side for competitive purposes. But at the time we do our breedings, I want them at either a 4 or a 5 for a body condition score, with this being a 1 through 9 scale, and maybe a 6, just a little bit of a 6. Now, the easiest way for me to teach this, and it's important that everybody that feeds dogs in your kennel, in your household, in your relationships of any kind with the help of feeding your dogs, is if they make a fist and if they feel the back of their hand where the back of your hand is, that's how the ribs should feel on a dog that's in ideal body condition. If you turn your hand upward and you feel across your knuckles, if that's how the ribs feel feeling a dog, that dog is too thin. That dog needs to have included extra calories in their diet. And then if you turn your hand over and the little ball of your hand, the pad of your hand below, just above your wrist, below your fist fingers, where it's a little squishy, that's when that's what the ribs will feel like if a dog is too heavy. So you can teach this easily to your staff, is the back of the hand is how the ribs should feel when you run your fingers across it. Easy to teach, easy to have, even inexperienced kennel help learn that so that they can start adjusting the intake of the dog, the amount of calories that they're taking and the amount of food and the type of food, so that the dog is at ideal body condition or maybe just a smidge heavy at the time we do the breeding. Now, in sheep and in deer, we know that if they carry just a little bit of extra body weight at the time that they're being bred, they actually have more twins and more triplets in sheep, in goats, and in deer and other wildlife. So we don't want them too thin, or they won't be able to have the caloric support that they need during the pregnancy to have nice, large pregnancies. But we also don't want them so heavy that at the time that they go into labor, that they're out of shape, out of condition, and they're not able to successfully deliver puppies. So that fine line is really important, that we keep them in that range. So this body condition score system is available online. You can look this up by Googling it, and it's a really useful thing to have in the kennel. The second thing I want to talk about is puppy and performance diets. So it's important that we're feeding our bitches appropriately, and we're going to talk about nutrition a little bit more as we go along. But I think either a puppy diet or a performance diet, and by performance diet, I mean something like the Purina Sport 30/20 diet, those are great diets to feed during pregnancy, during lactation, and then into weaning so that the puppies can very easily transition to the same food that mom is eating. Makes it an easy transition if you don't have to make diet changes along the way. So a simple Sport 30/20, Sport Performance 30/20 diet can support successfully all stages, including puppy growth and pregnancy. Now, folic acid, I think, is a really important nutrient, and it's one that a lot of people don't understand particularly well. Folic acid is important in reducing the risk of bitches producing puppies with midline defects. So midline defects are any place that the body comes together right side to left side that doesn't match up correctly. The one most people are commonly familiar with is cleft palate, but there are other kinds of midline defects that we'll talk about here in a few slides. There is a lot known about folic acid on the human side. We don't have great studies or great doses on the veterinary side. The only published dose that we have on the veterinary side suggests 5 milligrams per dog per day from about 6 weeks before the pregnancy starts to the 40th day of pregnancy, when the formation of the body is starting to complete. After day 40, the puppies get bigger and bigger, but they don't really develop additional changes to their tissues. So the problem is most times we see 400 micrograms as the capsules that are floating around out there that you can pick up at the store or online, and 5 milligrams would be 12 of those a day. So that's not a very practical amount, but that's the only published dose that we really have on dogs. Now, this is kind of an interesting study. This was done in Poland, and it shows that in pugs and chihuahuas, which are both breeds that are predisposed genetically to producing puppies with cleft palates and or cleft lips, that the bitches that were supplemented with folic acid had 50 to 66% fewer puppies with midline defects than if they weren't supplemented with folic acid. So if you have a breed or a line of dogs that you know has a tendency to produce puppies with midline defects, start looking hard at folic acid, but don't start it when you're breeding. Start at 6 to 8 weeks before she's due to come into heat, because she needs that level of folic acid in her body to adequately produce puppies that don't have midline defects. Now, if you're a squeamish person, this is probably not a good slide for you to look at, but we're veterinarians, so we look at things like this even during dinner. So midline defects are going to be things like cleft palate. So the puppy's oral cavity on the left has a cleft palate. You can see that that slit down the middle of the upper part of the mouth, that's a cleft palate. My staff is pretty well trained, and you can start training yourselves and your staff that as soon as a puppy is born, you want to flip that mouth open as soon as you've got the puppy breathing and take a look at the roof of the mouth to see if the puppy has a cleft palate. Every year we have people come in with puppies that aren't thriving. They don't understand why they're not nursing effectively. They can't really figure out what's going on. And as soon as my staff takes a look at them and realizes that they have a cleft palate, that changes the whole conversation about what we need to do with these puppies. Now, the same puppy that's pictured on the left is also pictured in the right picture on the yellow towel. And this is a little Labrador puppy that was born to a litter of a Labrador bitch with 9 other puppies in it. And the little red dot between her shoulder blades is a spina bifida lesion where she had an opening in the midline down into her spinal cord. And then if you look between her back feet, you can see that there are intestines out there. Off to her left is her placenta, but there are intestines out behind her feet. So this puppy had 3 midline defects. Fortunately, the rest of the litter was normal. So this is just an unfortunate set of circumstances. But with the wrong kinds of things happening, you can actually have an entire litter born with midline defects. So partly midline defects are genetics, and that's where we can overcome some of that, not all of it, but some of it with folic acid supplementation. But we also see teratogens, which is a compound or a chemical that causes birth defects. So a teratogen is the meaning of a birth defect. We can see trimethoprim sulfa, which is an antibiotic similar to Albon. If that's given during certain parts of the pregnancy, we can see midline defects. I actually had a client that gave some Albon to her bitch at around day 40 of her pregnancy, and she only had 2 puppies. She was a small breed, only had 2 puppies. And both puppies were born with open intestines or open abdominal wall with the intestines exposed. Vitamin A excesses can cause cleft palates and other midline defects that we see associated with either people that are supplementing with too much vitamin A or too much liver in the dog's diet during the pregnancy. Certain antifungals like griseofulvin that are used to treat ringworm can cause this, and steroids, so corticosteroids, prednisone, cortisone, betamethasone, a lot of those steroid type compounds will also cause midline defects. And those can be not just the oral medications like prednisone that you would give for an allergic reaction, but also topical products like ear medications or eye medications for infections in the ear or in the eyes. So before you use any kind of product on a dog that's pregnant or soon to be pregnant, you need to check with your veterinarian, read the label, and make sure that you're avoiding the use of any of these steroid type products, because even the topicals can be exposing the bitches by a really significant amount of absorption through the skin, through the ear, through the eye, and into the system. So please avoid the use of steroids if at all possible. The only time that these kinds of drugs should be given during pregnancy is if you're going to lose the bitch unless you medicate the bitch with this kind of medication. So be really careful that you're paying attention and your veterinarian is paying attention to the pregnancy. Then we need to talk about DHA. And DHA is a pretty interesting fatty acid. It's found in mother's milk, and we know that it improves vision and brain development. So it has been added to a lot of puppy foods and to baby formulas, human baby formulas as well. So it's actually pretty cool that some of the veterinary research turned out to benefit human medicine as well, because DHA is added to baby formula in most countries. So DHA and EPA are two fatty acids, and we know that the supplementation of these during pregnancy will improve neurologic and brain function. It does not negatively influence joint formation, so it's really important that you take a look at this. So this reference goes to the publication of this article. And of course, because DHA is so important, we're seeing it in the puppy foods as well. So we want our puppies to be smart. And there was actually a really neat study done at Canine Companions for Independence, CCI. Canine Companions for Independence is an organization in the US that raises service dogs primarily for people with mobility and social impairments. They don't do any seeing eye dogs, but they do hearing dogs, wheelchair dogs, all kinds of stuff. And I personally, in our family, we have raised 6 of these puppies, and my son, who is now an adult, is raising his first puppy. So it's puppy number 7 for our family. They did a study on 5,900 puppies that were raised in the CCI program. And what they found was that bitches that produced their first litter had a 50% graduation rate of their puppies going into service as CCI puppies. However, by the time the bitches got to their 5th litter, they had dropped down to a 25% graduation rate. So half of the puppies that they would have graduated were not graduating because the puppies just weren't as trainable, they weren't as biddable, they weren't as smart. So they started looking at DHA as a possible relationship to that, and they determined DHA did make that much of a difference. So that's where some of this really important research has come into both the human and the veterinary side. And then in 2012, the AVMA published this article showing that we saw better neurocognitive development with memory, psychomotor, immunologic, so immune systems, and eye function in growing puppies. So by adding DHA, we've really done a great job of improving the quality of the puppies that we're producing. So particularly important if you're going to have a bitch that's bred multiple times, that you start supplementing her with DHA prior to the time that she's bred, not at the time that she's pregnant. So if you have a pregnant dog, it's not too late, but if you haven't bred her yet, get your DHA and get your folic acid going. The next thing I want to talk about is raw meat diets. And I think raw meat diets are a hot topic for a lot of people. And for the people that are really, really devoted to feeding a raw meat diet, it's pretty difficult to convince otherwise that this is not a good idea during pregnancy. In general, I don't like raw meat diets for any stage of a dog's life, but there are people who are pretty committed to their raw meat diets, and it's pretty hard to talk them out of it. So I'm just going to make a couple of cases here for what we need to talk about, and just point out the problems that we see. So we see increased numbers of dystocias. Dystocia is difficult labor and delivery. So we see increased risk of dystocia or failure to deliver puppies without intervention with a C-section, primarily because the raw meat diets tend to have a calcium-phosphorus imbalance. So Whelpwise, Karen at Whelpwise has shown us pretty clearly that dogs on raw meat diets are at increased risk of dystocia or needing a C-section for intervention. If you're looking for more information on that, I want to make sure that I'm giving you references, that this isn't just stuff that I'm making up, but this is stuff that's actually documented. So Karen at Whelpwise has this information. Whelpwise is a whelping contraction monitoring service, and it also includes fetal heart rate development or fetal heart rate monitoring during labor and delivery. So they do produce equipment that can be used to help monitor pregnancy and delivery. So high-risk pregnancies and bitches that may have a difficult pregnancy or difficult whelping can really find this useful information. So it's important that you take a look at Whelpwise if you're looking for more information about the calcium and phosphorus imbalances that we see in the raw meat diets. Other things that we see can be organ meats, can be in too large a quantity. We can see other types of deficiencies, and then we can see the excesses of vitamin A causing these midline defects. So this is a little German Shepherd puppy that was born with the abdominal wall not being complete. Here we are in this picture putting this puppy under anesthesia. It's about 4 hours old, and we're putting her under anesthesia so that we can correct this defect that she has in her abdominal wall. Nobody wants a 4-hour-old puppy to need surgery. So please be aware that even though some of these can be fixed, it's better to prevent them by not feeding excesses of vitamin A, which can be found in organ meats, particularly liver or other deficiencies. The third thing I want to talk about is parasites. And I kind of feel like eating a raw meat diet is something like kissing a pig. So that's why I have this picture in here, is I want you to think about this. Now, I personally like my beef rare, but during my pregnancies, my husband cooked my meat to death because we didn't want to end up with any problems with parasites such as toxoplasmosis. And we also see neosporum. So we can see both toxo and neosporum in dogs that are being fed raw meat diets. There was a really interesting case study that was done from Antech. Unfortunately, because it belonged to Antech, they're not able to share the slides and the information with us directly. But there are definitely documentations of puppies that are born with neosporum, which they can pick up from raw meat, and toxoplasmosis from raw meat, and vegetables that may not be adequately cooked as well, that were grown in exposure to cat feces, that we can see neosporum and toxoplasmosis causing parasite problems in puppies. These puppies are born sometimes looking fairly normal, but as they develop, their nervous systems are not normal, and these puppies end up with ataxia, weakness, and many times euthanized. So we have to be concerned about those parasites. If it's caught early, you might be able to treat it, but it's much better simply to prevent it. And then, of course, we see other kind of bacterial diseases such as salmonella, listeria. We can see listeria from raw milk or under processed milk products. And there's a number of other bacteria. There's Campylobacter and Shigella and a number of other bacteria. So we have to be really careful that we're processing the food and that we're adequately taking care of our bitches. So that's why I really think that a kibble-based diet is a much safer diet during pregnancy and lactation. We had a litter of puppies, 11 puppies that we got a phone call about. We had managed the stud dog and shipped semen to the bitch. And the bitch ended up with 11 puppies. One night she went to bed and they were fine at 6 weeks of age. And when she got up in the morning, all 11 of them had neurologic disease. It's been fairly recent, so there's still testing that's pending at the diagnostic lab for the puppies that she lost out of this litter. She lost 4 out of the 11, and they were looking at listeria. Listeria is the bacteria that we see in underprocessed milk and some of the other meat products. It's the reason that pregnant women are told not to eat lunch meat, like prepackaged turkey and ham and those kinds of products. So we can see those in dogs as well. And then carbohydrates. We tend to forget sometimes how important carbohydrates are in the diet for dogs. A lot of people like the grain-free diets and they're fans of that, but unfortunately, bitches need carbohydrates to grow their puppies, and they need carbohydrates to produce milk and lactate. So if we are feeding inadequate amounts of those carbohydrates, our bitches are not going to have normal, bouncing, healthy babies and be able to lactate sufficiently. So if you have bitches that are having some difficulty, take a hard look at the kind of diet that you're feeding and make sure you're not on a raw meat or a grain-free diet. And then about 2.5 years ago, we started to see a lot of information hitting the internet about the dogs with cardiomyopathy, with the kinds of dilated hearts, dilated cardiomyopathy that was causing heart disease acutely in dogs. Initially, it was thought to be all related to peas and legumes and potato-based diets. We don't know exclusively what's going on with that, but if you take a look at many of the websites for the pet food companies, they've either started adding taurine and carnitine into the diets, or they have changed their type of products that they're putting in there altogether. So we try to avoid the peas and legume-based diets. The other question about the peas and legumes are the phytoestrogens and whether that influences fertility both in the dog and in the bitch. So we can potentially see problems with the male dogs not producing adequate kinds of testosterone and adequate sperm because of the phytoestrogens that are found in some of the pea and legume type diets. So be aware of that. So taurine, L-carnitine, phytoestrogens, those are all important things to take a look at and pay attention to. So now that I've told you all the things that are bad and all the things that are good, you're going to say, so, okay, so what am I supposed to feed? And really the easiest solution is to come up with a performance diet, such as the ProPlan Sport Performance 30-20. It comes as a chicken and rice, it comes as a salmon and rice, and it's a really great way to make sure that we have the peak fertility for our bitches. When I'm talking to clients that are struggling with fertility issues, either with the males or the females, the first question I ask them is what you're feeding, because I have found over the last several years in these conversations, as some of the more unique diets and boutique diets have come to market, that increasing numbers of people are feeding them, and we're falling away from some of the good basic nutrition that we see from
It's 7 o'clock.
Purina. So it's making it more difficult for us to make sure that we're producing dogs with good fertility. So stick to your good performance diets and realize that that's a great diet for nutrition for the males, for the bitches, and for the puppies. So remember, it's an all-age stage diet. So you're not going to have these nice big litters. This is a litter of, I think, 13 Bernese Mountain Dog puppies, 13, 15, I can't remember. There were a lot of them. So without good nutrition and without our bodies having the good equipment and the mechanics and the food that they need, the nutrients, we're not going to have great fertility. So then we need to talk about health screening. So we're going to talk about brucellosis, tick-borne and heartworm diseases, vaccinations, and genetic screening, just fairly briefly. So brucellosis is certainly not a disease that has been eradicated. We are seeing a resurgence of it in some of the dogs in the US. We actually had dogs that came into Wisconsin a few years ago that came through Canada from South Korea. They were shipped legally through Canada into the United States, and they found that in a group of 26 dogs that there were 4 dogs with canine brucellosis. So be aware that brucellosis has not been eradicated. It is still out there. We're seeing dogs coming into the country in increasing numbers, both for breeding purposes and for rescue purposes. So it's important that we're really paying attention to brucellosis and not thinking that it's a bygone disease. Every week I get a phone call from somebody that's got a situation with brucellosis, that they loaned their stud dog to a female and she had brucellosis, or they lost half of their breeding kennel to brucellosis. So be aware that it's not gone and it really should be tested for. Bitches should be tested before every breeding, and the males should be tested at least twice a year if they're actively being used as stud dog. And the symptoms can be anything from being normal to having sick and weak puppies to having fertility issues. So we've actually seen brucellosis positive dogs in our practice, and you need to be aware of that. So don't let your guard down, and if your veterinarian suggests testing for brucellosis, or even if they don't, you probably should do brucellosis testing. Then we need to talk about tick-borne and heartworm disease. We see a lot of tick-borne diseases in Wisconsin, and our surrounding states, Minnesota, and of course the East Coast in the US, but we also know that it's a problem up in the Canadian provinces as well. So be aware that tick-borne diseases are important to be tested for, and we are now in our practice recommending that every bitch before she's bred gets tested for heartworm and tick-borne diseases. I've had dogs come into the practice pregnant with heartworm disease, acutely arresting. I've seen too many bitches get really, really sick during late stages of their pregnancy from tick-borne diseases like Lyme disease, anaplasmosis, and Ehrlichia. It's simple to test for it as long as you're drawing blood anyway to do a brucellosis or to do a progesterone test. Just have them throw on a SNAP 40X test or whatever equivalent test your veterinary clinic runs so that we're sure that we are not breeding bitches that we should be treating and getting them healthy before we subject them to a pregnancy. We can also see declining fertility in the male dogs related to the fevers and the illnesses associated with tick-borne diseases. So don't let your guard down. Again, use your flea and tick products as preventive, and make sure that you're testing your dogs and you have them on heartworm preventives as well. So test and then test again. Vaccination, I think, is really an important topic. We do recommend vaccinating for distemper and parvo. We do recommend lepto. We do see leptospirosis in our practice. In fact, today I had a dog in that we diagnosed 2 years ago with lepto. He was told by his local clinic that the dog had renal failure, was going to die of kidney failure. Well, that was 2 years ago. He was back in today for a recheck, and he's doing very well. But lepto should be a disease that you can prevent with vaccination. It's given on an annual basis. Bordetella and the canine influenza bivalent vaccines are also important for these dogs that are going to be traveling, that are in competitions, that are going to be bred, that are in large kennels. It's important that we're vaccinating so that we don't end up with pregnancies going wrong or puppies that are sick because we failed to protect our bitches. I do like to use the syringe-free applicator for Bordetella vaccine. It comes in a couple of different ways. You can give Bordetella as an injectable, but it also comes as an oral and an intranasal product. Now, the oral product doesn't contain parainfluenza. It only includes adenovirus and Bordetella, so you don't get as much protection from the oral vaccine, and it's certainly easier to give, but the intranasal vaccine is definitely the product that I prefer because it gives us better protection. And I really like the syringe-free applicator because it's easy to make a mistake if you have Bordetella drawn up into a syringe that's meant to be given as a nose drop, and somebody gets busy or loses track of what they're doing and inadvertently gives the intranasal vaccine as a sub-Q injection. There are reports of dogs going into liver failure from that, so please avoid the use of it. Just don't even get a syringe out. Just put it in the syringe-free applicator. Go ahead and use it that way. Now, canine coronavirus is another kind of interesting virus. We don't routinely vaccinate for it in our practice. However, we do see kennels that have large numbers of dogs that end up with coronavirus. It typically affects puppies when they're between 2 and 4 weeks of age. So if you are losing puppies and it's been determined that it is coronavirus, and we just actually had one of these 3 weeks ago, include coronavirus in the vaccine for some of the bitches. We don't routinely use it unless you're having a problem, but if you're losing puppies, don't just lose them and not find out what the cause was. Have a necropsy done, a postmortem done by your veterinary clinic or at a diagnostic lab. Get a diagnosis and then adjust your vaccination program to what you need to protect your dogs in your environment against that. So the next question is, which vaccines are safe during pregnancy? And the answer to that is none of them unless it's canine herpes virus. And in the US and Canada, we can't vaccinate for herpes. That is a vaccine that's available in some of the European countries, but we don't vaccinate for it in the US because we can't get the product. So if you can't get herpes, you shouldn't be vaccinating for anything during pregnancy. You're going to set the bitch up for some kind of an inflammatory change that could result in a lost pregnancy. So do not vaccinate during pregnancy. Look ahead at your schedule, see when she's due for vaccines, make sure she's up to date before you vaccinate or before you breed, and vaccinate well before the pregnancy is due. And then genetic screening, I do want to mention that we should be doing OFA hip and elbow x-rays, we should be checking eyes, we should be checking hearts, and there are a lot of DNA tests that are out there that are really important that we should be testing for. But remember, when you're doing your breeding program and breeding plan, that everything is taking longer to get results on. It's harder to get an appointment to see a cardiologist or an ophthalmologist. It's harder to get an x-ray appointment. It's harder to get the results back. It's taking longer. Some of the PCR testing is hung up right now at some of the diagnostic labs because of supply availability. So don't wait till the last minute when she's ready to breed and think that you're going to run in and get some of this testing done. It's not happening that way. So pay attention, get your testing done. And there are lots of labs that are doing DNA testing. I would advise you in general terms to make sure that you're picking a diagnostic lab that has verification of their results, and realize that some of those big panels that are testing for 50 or 60 or 100 diseases on dogs as a screening test are not giving us as accurate information as we would like. Some of them are just doing one test instead of the 2 tests that they do. If you do like the 6-panel test for a golden retriever, they do 2 sets of DNA tests on those dogs. if you do the 100 test screen or whatever the number is, they're tending to just do one screening test and not verify it with a second diagnostic test. So sometimes those tests are not as accurate as we would like them to believe. The other thing is they are testing dogs for DNA diseases that we don't even know happen in certain breeds. So if, for instance, I have Pembroke Welsh Corgis and they're testing for diseases that have never been seen in a Corgi. So that's really interesting information from a scientific perspective, but it doesn't really help you with your breeding program. So stick to things that we know, use a diagnostic lab that you trust, and really pay attention to how the results are being provided to you so that you are getting accurate results. There are very few governmental oversights on the DNA tests, so be a little suspicious. Count on your breed club to help you pick out the right kind of tests and the right diagnostic labs and support the research that it takes to get good DNA testing. Preventives for heartworm and flea and tick, and I know you probably don't have as much of a problem with heartworm as we have in the southern United States, but we still see heartworm in every state in the United States, including Alaska, so I'm sure you have it in Canada as well. So we want to make sure that our bitches are on appropriate heartworm medication and on appropriate flea and tick preventives. So heartworm disease really is heartworm. If you haven't ever seen a dog with heartworm, this is what their heart looks like. It's kind of horrifying. That worms actually live in the heart, and of course they affect the circulation. They can also clog up the circulation to the liver and the kidneys. They can cause eye problems. They just cause a whole multitude of things. So most of the heartworm preventives on the market are safe for pregnant bitches. It's important to read the label. I try to avoid the use of any heartworm preventive in the first 3 weeks of the pregnancy. So I time it so that just before I breed the bitch, and then 4 weeks later, I give her her heartworm preventive. And that way we're not giving it during the first trimester, which is when most of the genetic or the teratogenic effects of a chemical that's going to cause a problem with a birth defect are going to happen in the first 3 weeks. So avoid the first 3 weeks of the pregnancy. That's the first trimester. So give it before the breeding, give it 4 weeks later, and you can avoid that 3-week period. We know ivermectin, which is Heartgard, and Interceptor, milbomycin, and moxidectin, which is the injectable heartworm preventive. Those are all known to be safe during pregnancy. I still try to avoid the first 3 weeks anyway. Trifexis is not labeled for use in pregnant dogs, so I try to avoid the use of that product. So heartworm preventive should say on the label, safe including pregnant or breeding females, safe in stud dogs, safe in puppies aged 6 weeks or more. So read the label. It's simple to read. If you have the package, it's easy to pull out the package insert, put on your bifocals, and take a look at that reading on there. Or you can Google it. If you Google search the product and then include in that package insert, PDF package insert, it will bring up the package insert that you can see what your veterinarian is actually getting and what the product has in the packaging so that you can read the information. Now, not all flea and tick preventives are safe. They're not as universally safe as the heartworm preventives. So make sure you're reading the label on the packaging. It should say if it's safe in breeding animals. Now, a breeding animal means a breeding animal. That doesn't mean a pregnant dog. And I have a lot of people that are coming into our practice with flea and tick preventives that the dogs were put on and not realizing that it's not labeled for use in breeding pregnant or lactating dogs. So if you have a 6-week-old puppy and you're keeping her in your breeding program, she is a breeding dog. She's not pregnant at 6 weeks of age, but she is a breeding dog. If it's your male dog, your next up and coming stud dog, and he is 8 weeks old, make sure you're reading the package labels. It should say if it's labeled. So if it says not evaluated in breeding pregnant or lactating dogs, don't use it. The only oral flea and tick medication that we have that is known to be safe during pregnancy is Bravecto. And the package actually says there were no clinically relevant treatment-related effects on the body weights, food consumption, reproductive performance, semen analysis, litter data, gross necropsy, or histopathology in adult dogs and puppies. That's what the package says. The other products, Credelio, Simparica, and NexGard, are good products. They're in the same drug class, but they are not tested on breeding and pregnant dogs. So avoid the use of products that we don't have data on. And if it's a product you really like, then tell the company you can't buy it unless they do the testing. They need to have the pressure to do this. And if Bravecto has gone to the trouble and expense of testing, then count on a product that's been tested and not on something that's unknown. You don't want your dog's litter to be in that footnote of a paper that said, oh, and by the way, there was one litter that this happened to. Don't be that person. Be safe. All right, ovulation timing is a really important part of predicting when the bitches should be bred. So we like to do our ovulation timing using progesterone testing. This graph shows very clearly how estrogen, LH, and progesterone all interplay during the heat cycle. And you can see that the LH peak rises very quickly and then drops, but the progesterone starts to rise at the time of the LH peak and continues to rise and stays high for the next 63 days during pregnancy. So I don't want to turn this into an ovulation timing lecture because we could spend a whole hour on this, but suffice it to say that when we do our breedings, and most veterinarians do their breedings, we breed 2 days after they ovulate with fresh semen or a natural breeding and 3 days with frozen semen. Now, our numbers in the US are going to be around 5, but your numbers are going to be about 3 times that. So somewhere around 15 is when you want to do your natural breeding on your nanomoles per deciliter. And with frozen semen, it's going to be around 60. So we like to test every 2 to 3 days until we see where the ovulation peak is. And then we'll start timing down, and then 2 days with fresh and 3 days with frozen semen. LH peaks, we usually breed 5 to 6 days later. The concern with LH is that, as you can see from this graph, the LH peak is very short. It's only about 24 hours long. So if you're doing LH testing, you have to test on a daily basis. On progesterone testing, you can test every 2 to 3 days and very effectively catch the bitch when she's in her fertile period and get the semen in, depending on the kind of semen, at the right time. So what's the other reason that we want to do our ovulation timing? And that's not just to know when she's due to whelp or due to be bred, but also when she's due to whelp. So we need to get her unpregnant at the right time too. So if we have bitches that have a high-risk pregnancy, like they have 16 puppies, or they get sick during the pregnancy without knowing the exact time that she's due, you're going to have a much more difficult time managing a high-risk pregnancy. So yes, you may not need to do ovulation timing to get her pregnant, but when the rubber hits the road and she's sick during the pregnancy and you don't know when she's due, you're in trouble. That's when you really need to have this information. All right, so when we're talking about our breedings, we want to know some history on our bitches. We want to know her age. So I don't like to breed bitches that are too old. I want to know how often she's having heat cycles. Bitches need at least 4.5 months between heat cycles to effectively have uterine health that will carry a pregnancy. They may ovulate if they have heat cycles at 3 to 4 month intervals, but they probably aren't going to get pregnant and stay pregnant. I'm also going to want to know her past history and her mother's family history of pregnancies. So if she has a mother that drops progesterone or a mother that had only singleton puppies, those are all important pieces of information for us to have when we're planning our breedings. And then when we're doing our boys, we want to have the same kind of information about how they are going to be used for stud service, what their fertility is, and so on. So we want to progesterone test our bitches. We want to know where we're going to do the breeding, what type of semen you were using, what kind of insemination we're using, what the stud dog's fertility is, what his current fertility is, if he's been proven or not, if he has a family history of issues. What's your backup plan if the stud dog gets sick, if the stud dog's semen doesn't get to you when you ship it because UPS or FedEx or the Postal Service lost your shipment of semen. So we want to know all those things. So it's really important that we plan our breedings carefully and that at the last minute you are not scrambling to find a new stud dog because the one that you planned for didn't work out. And then we need to talk about uterine health. It's really important that our bitches are young and healthy and that they're well fed and well nourished and that we've done all of our testing so that we have good uterine health. A lot of people like to have career bitches before they do their breedings. This is one of my corgis, and of course, as soon as they win the national, they never get pregnant, so be aware that that's the curse. So should she have a career first? Is she a career dog? Should she be a busy girl out there getting points on championships, or is she getting titles, or is she out in the field? Is she working as a service dog? Is she a field dog? What kind of expectations do we have for these dogs when we wait until they're 6, 7, 8 years old before we breed our bitches for the first time? So it's important that we think about breeding our bitches young, at least the first time. Get a litter out of her, let her go back, finish up a career. These bitches will come back into shape and be in good condition. They can come back out and be shown again after or compete again after they've had a litter. So we want to breed our bitches young because we want to have nice, healthy uterine health. So we see better fertility, more puppies in every litter, more litters, a lower risk of C-section or other dystocia, a lower risk of other diseases like kidney disease, diabetes, other things. All those things are going to be at lower quantities, lower risk if we breed our bitches when they're young. So you want to have her old enough to have her health screening, but you want to have her young enough to have good health of her uterus, because as bitches age, after the age of 6, we see a 33% decrease in fertility in bitches. And the number one risk factor that we see is cystic endometrial hyperplasia, which I'll show you some pictures of in a few minutes, which is it's associated with pyometras. And in our boys, we see benign prostatic hypertrophy or hyperplasia as they reach 5 years and up. So if we're waiting too long to start collecting semen and start to breed our bitches, we're going to end up with poor fertility. So if we have a problem with uterine health, with cystic endometrial hyperplasia, we'll use anti-inflammatories, sometimes antibiotics, and we need to look at the micronutrients in the diet that really make a difference in fertility. So we can help manipulate some of this, but sometimes the changes are so significant with cystic endometrial hyperplasia that an older bitch will never get pregnant. This is the lining of a uterus of an Airedale that we took to surgery with the expectation of putting frozen semen in. And what you should see in the lining of the uterus is a nice, smooth, shiny pink surface. This looks like bubble wrap. She's got all these cystic structures in the lining of her uterus. So when you hear veterinarians talk about cysts, or you talk about breeders that said, oh, well, my veterinarian popped the cysts in the uterus and then she got pregnant. Well, if there are 2 or 3 cysts in the uterus, I believe that. If the uterus looks like this, where there are cysts on top of cysts, there's not 1 square millimeter of normal uterine tissue for a placenta to attach to. And if the placenta can't attach to the uterine lining, you're never going to have a successful pregnancy. She may conceive, but she'll never carry a pregnancy to term. So this is why we see a decline in fertility as bitches age. So it's super important that we breed them young and that we pay attention to what's going on with their uterine health, and that we also realize that this kind of change puts our bitches at increased risk of pyometra. So pyometra is kind of an interesting disease, and I think there's a lot we don't know about it in dogs. I think there's got to be more than one kind, because we certainly see bitches at a year of age that have cystic endometrial or have pyometras without cystic endometrial hyperplasia, but 6-year-old bitches, 8-year-old bitches that have cystic endometrial hyperplasia with secondary bacteria, and then the pyometra develops. So the question then becomes, which comes first, the chicken or the egg? Is the pyometra there because of the cysts and then bacteria come in, or is the bacteria there and then we see the cysts forming? And we don't really have good answers on this. So this is a picture of a little Boston Terrier that we spayed in our practice. This is her uterus that we took out of her. You cannot imagine how much her abdomen was distended by a uterus this large in this poor little dog's belly. So we need to be attentive to our bitches, and if they have any suspicion of a pyometra, you need to get in and have your veterinarian take a look. This is another pyometra that we were doing a spay on. So we typically see this as a bacterial infection secondary to progesterone. It only happens after a heat cycle. We can see infections in the uterus after a pregnancy, but that's metritis, not a pyometra. So it's a different process, and we don't need to spay our bitches with metritis unless they're desperately sick. Most of the time we can manage those effectively with antibiotics and prostaglandins. And there are a lot of bitches that we also manage pyometras on successfully, but if they have a uterus that's going to look like this bitch, no matter how hard you try to manage her, she's never going to get pregnant. So we want to make sure that we're breeding them young and that we don't end up facing a bitch that's never had the success of a pregnancy and then having to spay her because of waiting too long and ending up with a pyometra. Now, this is a really interesting bit of information. This is from an article that was published in 2015 in Sweden. And the reason that Sweden has this information is because all of their dogs, or almost all of their dogs, are insured. So they have data on dogs that we don't have in the US and in Canada. They also tend not to spay their bitches and neuter their dogs as we do here in the US and in Canada. So they tend to have a lot more dogs that are intact. So it was kind of an interesting study that showed the incidence of pyometra by breed, the incidence of mammary tumor by breed, and then the incidence of dogs that had both pyometras and mammary tumors. So you can see on here things like the Bernese Mountain Dog, the Great Dane, the Leonberger, the Rottweiler, the Irish Wolfhound, the Staffordshire Bull Terrier, Those top 6 dogs have a really interesting connection that I think we need to look at. But anyway, 46% of Bernese Mountain Dogs that are not spayed will end up with a pyometra. I don't have the stats on everybody else, but you can certainly look this paper up. It was published and presented at the International Symposium for Canine and Feline Reproduction. If anybody wants to see the paper and wants to email me, I'll send a link to that paper for you. So look at these top 6 dogs: Bernese Mountain Dog, Great Dane, Leonberger, Rottweiler, Irish Wolfhound, and Staffordshire Bull Terrier. Then we drop down to Bull Terrier and Bouvier. And this is what I think we need to think about is we've all heard of the history of these breeds that go back to this Mastiff type dog that were around the European countries and other parts of the world that were a Mastiff type dog. And if you look at those, that's kind of the genetics that come into play in all these top 8 of the 9 dogs. So I think it's kind of interesting that this kind of tendency to have a pyometra goes back so far in the DNA of dogs. This isn't something that we have recently created as dog breeders. This goes way deep, deep, deep into their DNA, thousands of years. So it's unlikely we're going to breed our way out of this. Now, there are bitches that can be successfully managed with a pyometra. This is a bulldog that belonged to one of my employees. She had a pyometra in one horn and a pregnancy in the other. As you can see, we successfully got her to term and had 4 nice babies from one horn. 5, 1, 2, 5, yeah, nice babies. This is Amstaff that had a nice litter of puppies after a pyometra. We managed her through a pyometra. This is my daughter's Bernese Mountain Dog litter. This bitch had a pyometra when she was 2, so obviously not cystic endometrial hyperplasia. Had a litter at 2, or a pyo at 2, an unsuccessful breeding at 2.5, and a litter at 3 years of age, and then another litter when she was 7 years old. So you can successfully manage pyometras if you're catching them early and if the bitches are not too old, that it's not going to be successful. All right, so uterine health, like I said, we need to talk about cystic endometrial hyperplasia, which is difficult to manage, but if we can prevent heat cycles without pregnancy, if we can either keep the bitches from coming into heat or breed them when they're young, we're going to have a lot less of it. If we do have those kinds of changes, sometimes an anti-inflammatory and an antibiotic can be helpful, along with the micronutrients that we see in high-quality kibble dog food. All right, so high-risk pregnancies, I just want to go through some of the causes of that. It can be poor nutrition due to either inadequate calorie intake, raw meat diets, or grain-free diets, stress during transportation, crowded housing and stress, bitches that get sick during their pregnancies. Canine brucellosis, of course, is the worst. Tick-borne diseases, metritis, and ascending bacterial infections. We can also see puppies that become sick from herpes or neosporum. Certain drugs and hormones that are used during pregnancy can put her at risk. Trauma, of course, if she's in some significant kind of trauma, that's going to interfere with the pregnancy. If the bitch or her mother or her grandmother has a history of going into labor prematurely without keeping her progesterone high, that's going to put her at risk. Some of the rescue dogs are also put at risk because of the transport and the stress that goes with it. So these are all things that we can see as high-risk pregnancies that we want to try to avoid so that we can have a successful pregnancy. So we're going to just talk about pregnancy for a little bit here because it is, of course, preparing for the pregnancy. So we hopefully are going to get to the point of having a successful pregnancy. We want to make sure that she's getting quantities that are sufficient to keep her well nourished, but not so much that she's overweight. During the first 4 weeks of a pregnancy, we don't increase the amount of food that bitches need. A lot of them at around the 4th week have a pretty lousy appetite. They don't feel good. They have a little morning sickness. At around the 4th week, they don't eat well. Between the 3rd and 5th week, that is low appetite is probably the most reliable sign of pregnancy that we see in the dog. And then, of course, just before they go into labor and whelp, they tend to not eat very well for a day or two. And then, of course, during labor, won't eat well. So during the first 4 weeks, we don't change anything in their diet. During the last 5 weeks, it's a pretty good rule of thumb to increase about 10% a week, unless you're expecting an extremely large or an extremely small litter. If you're expecting only 1 or 2 puppies, you may not want to have her gain quite that much weight. If she's having a particularly large litter, you may have to increase it more than that. So don't forget how to feel the back of your hand and compare that to the ribs for assessing her body condition. We also know that a lot of females won't eat particularly well because of having some GI upset with the pregnancy. So many times the Fortiflora products can be helpful. We also have 2 or 3 years ago, before all the COVID travel was stopped, we had a number of lectures on the theriogenology side of things that talked about the probiotics reducing the risk of mastitis and metritis. So those are some little tricks that you can do if you're having problems with mastitis or metritis, which is an infection of the uterus, that we can probably reduce the risk of that by adding some of the probiotics to the diet. There's not a lot of published information, but those are fairly significant anecdotal reports. And then we have diarrhea and parasites. I think it's really important that we manage our bitches well for their parasite control. We know that parasites migrate through the placenta and through the milk during pregnancy. So that migration, if the bitch had puppies or had parasites as a puppy, if she had roundworms or hookworms as a puppy during her pregnancy, the stress of pregnancy and the hormones will allow those parasites to reactivate, come out of the cysts that they're living in the muscles, and re-enter the circulation, going through the placenta and going through the milk. Now, if it disrupts the placenta by large enough numbers of parasites migrating, you can see resorptions as a possible sequela to that. So it's important that we manage parasites really well for our bitches. So what we recommend and have been doing for a long time with our females is, instead of using Panicure for the 3 days that the label says, we use Panicure for 5 straight weeks. It's the last 3 weeks of the pregnancy through the first 2 weeks of lactation. Now, that's an off-label use. It's only labeled for 3 days in the US and in Canada. So it's important that you know that this is not on the label, but it has been wildly successful in producing puppies that are much healthier. The puppies aren't born with parasites. We see fewer resorptions. We just overall see a healthier pregnancy and a healthier litter of puppies. So instead of when those puppies are 3 or 4 weeks old, they get a little diarrhea, they don't feel good, it's about the time you're weaning them because the parasites are migrating into their gut, it's important that we keep that from happening. So this information was published in 2002. Again, I can send you the information if you're interested, but this is not brand new information. This has been floating around for 19 years that veterinarians have known this information. But if you don't do a lot of canine reproduction, you may not be aware of it. So if you work with a veterinarian that's heavily involved in repro, they probably know this. If you work with somebody that isn't, this may be new information to them. But it is really good, a great way to raise healthier puppies. I have clients that come into my practice and they walk in my front door and they throw their arms around me and they say, Dr. Greer, I've never had such healthy, robust puppies as I have this litter. That Panicure is amazing. So Panicure, fenbendazole, all the same product, works really well. I like the suspension product because it's easy to give. It also comes as a granule, which is labeled for use in dogs. So it's a great product. And I dose it at 1 cc per 4 pounds of body weight. So a 40-pound dog would get 10 cc's. It's pretty simple to calculate. Then we don't want to forget about our boys, because it's important that the boys are also healthy. So remember, this is one of my clients that took this picture. This is not my dog, but this is a physician who apparently needed more to do than just breed dogs, because she had time to dress them up as they were getting married. So we're going to talk about testicular health, prostate health, orthopedic health, and then semen availability. So testicular health, if we're having problems with the boys, we want to look at their nutrition, make sure they're not on a grain-free diet, make sure they're getting enough L-carnitine in their diet because of the importance of the L-carnitine in helping the little sperm to swim to the egg. We use Pernamuscle as a supplement, and then we also use some fatty acids and some other antioxidants to improve semen quality. A lot of dogs over the age of 5 have an enlarged prostate. So instead of using an antibiotic, because this is not an antibiotic responsive disease, this is a hormonal disease. So finasteride is our drug of choice for dogs with benign prostatic hypertrophy. If they do have benign prostatic hypertrophy, they may have blood in their ejaculate or blood dripping from the penis. So again, it's simple enough to have this checked and have your veterinarian assess the prostate either on rectal exam or on ultrasound and make sure that the dog's prostate is normal. If you do have blood in the ejaculate, we can frequently get that benign prostatic hypertrophy or hyperplasia under control for finasteride. This is a prescription product. It is something your veterinarian should prescribe for your dog if it's indicated. So if you're having problems with semen with blood in it or blood dripping from the penis of the dog, make sure that you get your veterinarian involved in this, because we do see a decline in fertility if we don't get these dogs managed appropriately. Now, blood in the ejaculate itself will not interfere with a pregnancy or with the breeding, but it is important that we include that information. So if you have older dogs that are starting to have some back problems or some joint problems, there are mobility diets that we can put these dogs on that improve their ability to mount and breed bitches. So if you're struggling with that, keep that in mind. And then there are, of course, multiple ways that we can do inseminations and multiple types of semen. So it's important, again, that you know what kind of semen you're using and what kind of insemination you're planning on. Natural breedings, of course, are the oldest and the simplest way for this to work. But if you're shipping semen, either fresh, chilled, or frozen, you want to consider doing a transcervical insemination or a surgical insemination, and that you plan this well enough in advance that you don't have any surprises, or you don't have this unplanned if the semen quality isn't what you're expecting. There are a lot of veterinarians that do a really great job of doing transcervical inseminations, but it takes a lot of specialized equipment to do that. Surgical inseminations can be done if the semen quality is poor or if the bitch has a history of poor fertility, and that can be done by any veterinarian that wants to learn how to do the procedure without specialized equipment and without a lot of expense. So that's what we have for you tonight. We were told by Jackie, we're going to have about a 5-minute bio break, so run and grab yourself a drink, run and take care of whatever your needs are, and then pop back on here as soon as we finish this, because we're going to have a nice chance for a question and answer. So Jackie?
Hey everyone, it is Alice Keith here, and I'm with Greer Pro Club. So just before we head off for our break, I'm just going to tell you a little bit about the benefits that we offer to breeders and what our #1 formula is with our breeders. But first, I just want to talk about the food. So ProPlan has a history of leading groundbreaking innovation rooted in scientific expertise. For example, we have launched breakthroughs in taste and palatability, like shredded blends, a hard kibble combined with tender shredded pieces for a taste and texture that dogs love. So give that a try for any picky eaters. New senior foods that improve mental alertness, and guaranteed live probiotics that support digestive and immune health. And I know we're mostly dog people here, but I just think this is really interesting to share. In 2020, we launched Live Clear, which is scientifically proven to reduce allergens in cat hair and dander in just 3 weeks. All of this is possible because we have over 500 scientists on staff, including nutritionists, veterinarians, and pet behaviorists. All of our ingredients are nutritionally essential for what dogs need to thrive, and real meat, poultry, or fish is always the #1 ingredient in ProPlan dry formulas. Okay, can you take us to the next slide, Dr. Greer? Okay, no surprise. The #1 formula with our breeders is the ProPlan Performance 30/20 All Life Stages formula. Dr. Greer mentioned this one as well, as it supports the nutrition and energy needs of pregnant and nursing mothers and their puppies. The 30/20 stands for 30% protein and 20% fat. This concentrated nutrition helps optimize oxygen metabolism for increased endurance, and that's why it's also very popular with sporting and competition dogs. That said, we have a full product assortment for various nutritional needs, from sensitive skin and stomach to formulas for breed sizes, weight management, various proteins, and much more. Last slide. Pro Club offers great benefits, including savings on every purchase of ProPlan, free delivery to select regions for large orders, and unlimited free puppy kits for your new pet owners that includes a small bag of ProPlan. We really value breeders and provide one-on-one customer service out of our Canadian office to make sure that all of your needs are met. So if you're interested to learn more, please visit purina.ca/proclub. You can get in touch with us there. Feel free to ask us for any formula recommendations for your dogs, and you can also sign up online right there.
Okay, alrighty, we're at 8:42, so time for some questions. We have a lot down in our Q&A, so we are going to try to get to as many as we can. And I may not answer your question in particular because we have some that are all on the same topic. So I'm going to bulk some together. So the first one we have was from a few individuals, and they were looking for you to expand a little bit more on what age you would consider breeding to be, what age is too old for you to breed your dog. In particular, there was a question around toy breeds and if there's a variance in that age level.
Yeah, those are good questions. So I typically don't like to see bitches bred over the age of 6 if they've never had a litter before, and over the age of 8 if they have had a litter. Now, there are certainly exceptions to that. I have performance dogs that come in that are running sled dog trials, like the picture I showed earlier. The field trial dogs, some of those dogs are incredibly fit, in really good condition, and still healthy enough to have a nice litter and health, good enough uterine health for a nice litter. The concern with breeding bitches that get too old is sometimes they'll get down to where their fertility is poor and they end up with one puppy, and it's a giant puppy because it's a singleton. And then you end up having to go to surgery, so to do a C-section. So you want to think carefully about the risks and benefits. If it's an older bitch, I think it's important to do a blood panel on her, a profile, to make sure that metabolically she's okay with her liver and kidney function before you impose the burden of a pregnancy on her. The toy breeds, they tend to live to be older, and if they're in general good health, I think you can probably breed them a little bit older, but anytime you start breeding the older bitches, anything over 6 to 8, the decline in fertility is such that you run the risk of a smaller number of puppies in the litter, and therefore an increased risk of dystocia in C-section and puppy loss. So think it through. Now, one of my own bitches just had a litter of 7 puppies. She's 7 years old, and she whelped them in 2.5 hours. I mean, she's amazingly physically fit, in really good condition, well fed, not overweight. So, and has had 2 previous litters. So that's kind of my rules of thumb, is not for the first time if they're over 6. We've waited, I think, a long time to breed those females, and I think it's pretty hard on them to have a litter for the first time at that age.
We also have quite a few questions around folic acid and DHA, and good sources for that. How do you give it? Is it by prescription, or can it be found in certain foods?
Sure. And certainly the products like the Purina puppy products do have DHA and do have folic acid added to them, but it may not be enough for subsequent litters or bitches that have a tendency to be genetically predisposed to cleft palates. You don't need prescriptions for either of those products. DHA would be something like salmon oil. You can buy that many places on the internet, at the store, your local pharmacy or department stores that carry a lot of those products. You can buy them online, so they're not difficult to get. So DHA, I think, is a really interesting product. I think we have just barely tapped the information on that, and we think that that DHA also reduces the risk of things like dementia. So write this down, because if you forget, you're going to need to look at your notes. But buy DHA, start yourself on it too. I mean, it's just fish oil. It may not help with heart health the way it was at one time thought to, but it looks like it's probably going to be helpful for brain and eye development of the puppies, and for cognitive dysfunction in people and in dogs as they age. So DHA is a great product.
On that same topic, we had a few questions around the doses of it, and is the 5 milligrams per dog per day. Does the size of the dog matter at all, or the weight of the bitch?
Yeah, and that's the problem we have, is that's the only study that shows anything about a dose. I don't think all dogs need 5 milligrams, but we don't have any other data on it, so that's the only information that we can really share. Most of the time, the capsules come as a 400 micrograms, so probably 1 or 2 of those is sufficient for most dogs. DHA, again, there's not really much published, but as a practical matter, if you would take 2 capsules a day, because that's what the package says for a person, you'd probably give 1 to a dog. So a lot of the products can be both human and veterinary. I mean, you can use some of those products on yourself as well as your dog. There's a lot of great nutritional supplements out there. The problem with nutritional supplements, I know in the US and likely in Canada, is that the only thing they really have to prove is safety. They don't have to prove efficacy, and they don't have to prove that what they say is in the product is actually in the product. So that's where it gets a little tricky. So you need to buy from a product source that you really trust. So stick to name brands that you think, Rexall drugstores and Walgreens. I mean, places that aren't going to try and sell you fish oil that really isn't fish oil. So be really careful what your source is. And, there are a lot of people who believe in supplements for themselves, and those are the people that tend to take supplements seriously and give them to their dogs as well. So think a little bit about how you plan your own nutritional supplements and kind of apply that to the dogs. A little may be good. That doesn't mean more is better. So use them in moderation. Be smart about it. Don't buy things that seem ridiculous, but just look at the quality of the product out there and see if there's any kind of certification on them, or if you trust the company that is producing them and if they have clinical trial studies. Products like Nutramax makes, they have clinical trials on those products, but not every supplement company does. So choose your supplement companies like you choose your DNA companies. Think hard about it, be careful about it, check with other people, see what their results have been. Just use your head about it and don't go overboard with them, because too much is not necessarily better.
Our next question comes from Lise, and she asks if you know if a puppy can be imported with brucellosis, have no symptoms, and be a carrier of the disease until they are old enough for breeding.
They probably can. Most countries don't require brucellosis testing before a dog enters the country, the US and Canada included. So you could have that happen. So before you purchase a dog that you're going to import from overseas, you should probably have either the puppy tested or the adult dog tested to make sure that they're not carrying brucellosis. It can lay dormant. It can look like not much is going on. They call it undulant fever in people. It's a disease that hides out in your bone marrow and never goes away. And if a dog has brucellosis, the recommendation is euthanasia. It's a nasty disease, so be careful. It's a zoonotic disease, meaning that people can get it as well, which is one of the reasons that people get so alarmed about it, is because it may not just affect the dogs, it may affect people as well. So if you're buying a dog that you're importing for a breeding purpose, you probably should have brucellosis testing done before you spend the money on the purchase of the dog and the import, because it's not cheap to bring dogs into the country. We see them coming into the U.S. with brucellosis. We see them traded around the communities with brucellosis. We see, when they have depopulation sales, like a kennel may say, well, we're just going to sell off a bunch of our breeding stock. They may be selling them off for a reason, and they are not required to test for brucellosis before they sell those dogs. So be really smart about it, and be careful if you're helping with rescue dogs, that you're not picking up a rescue dog that may be carrying brucellosis. Bring it into your house or your kennel or your car. And, being a good-hearted person that you are, trying to help with a rescue situation, that you end up bringing brucellosis into your household. It's a disaster.
We've also have a lot of questions on the Panicure. And
Yeah.
it kind of re-explain that a bit. There are quite a few people who said they've never heard of this before.
And that would be true, because a lot of people don't know about this. So it was published in 2002. So I'll just put the slide up again, so you can either take notes or grab your cell phone and take a picture of the slide. But it is an interesting approach to the use of it. I have used it for years on my own dogs, on client dogs, and it is wildly successful in reducing the migration of parasites. So roundworms, if the bitch had roundworms as a puppy, they will reactivate when she's pregnant, and they will enter her circulation and cross through the placenta and into the puppies, and in the process disrupt the placentas. And hookworms will do the same thing, except they don't go through the placenta, they go into the milk. So the bitches will produce milk that have hookworm larvae in it, and then the puppies will ingest those. So puppies before they are 3 weeks old can already have a heavy parasite burden of roundworms and hookworms that will interfere with their growth, cause diarrhea, make the puppies sick. So by doing this protocol, you interrupt that part of the life cycle that allows those parasites to migrate from the bitch through the milk into the puppies, and through the placenta and into the puppies. And therefore you will have puppies born without roundworms and hookworms, because you've probably all been told you need to deworm all your puppies because of parasites. But this is a way that you can prevent the puppies from becoming sick, or from the placentas being disrupted and causing resorptions, by doing this protocol. So it is not something a lot of people are familiar with. Like I said, a lot of the repro vets are, but if you're not working with somebody that's actively engaged in a lot of canine reproduction, they may not be familiar with this. If you send me an email, I will send you the article that explains the use of this, and it's still off-label, no matter how the publication says. The package label doesn't say this, so it's an off-label or an extra label use of the drug, but it's very safe and it's very effective. For the average large breed dog, it's going to cost around $100 to do it. For small breed dogs, of course, considerably less. But if you save yourself a trip to the vet, you save yourself sick puppies, you don't have parasites, you don't have puppies that are having diarrhea, not growing well, not gaining weight well, that are sick and not feeling good, it is well worth every penny that you'll spend. Now, the bitches don't like this medication. You have to mix it with something or syringe it into them. You can't just put it on top of their food because they're not going to eat it. It doesn't taste good. But it is worth every minute that you spend putting this down the dogs to prevent parasites, especially if you have dogs that you've imported from maybe the southern US or other parts of the world where they may have more parasites. You know, the further north you go, the fewer parasites you have. So I'm not saying that Canada is parasite free, but you do have less parasites than if you lived in Florida.
Cynthia asks if you can show on camera how to do the weight check with your hand that you mentioned.
Oh, I don't know. Can I do that? Should I just stop screen sharing?
So they can see your video right now if you.
Okay, well, okay. So here's your hand. Can you see it?
Yes.
So the back of your hand right here is how the ribs should feel when you go across the bitch's rib cage. If they feel like your knuckles, she is too thin, she needs more food. If it feels soft and squishy like this part of your hand, she's too fat. So right here is too fat, right here is too skinny, and right here is just right. Really easy. You can teach this to anybody in your kennel. They can do this.
Okay, our next question comes from Joan, and she says, swimmer pups and kittens with abnormal breastbone length, then improper attachments of ribs, genetic or possible nutritional, either deficiency or excess.
I don't know. I have had puppies of my own that have been born with normal shaped chests, nice and round. You put your hands around them, they feel nice and round. And by 3 days, they're flat. They have an angle at their rib cage that you can just feel this sharp angle. I don't think we know about it. And I don't think we know enough about this. There are probably multiple chest wall defects, thoracic wall defects in puppies and kittens. There are some procedures people do that they suture through the breastbone and tether it to a splint. That's a pretty harsh surgery on a newborn puppy. I don't really know what comes first, because you'll have puppies born round and then they start to have trouble breathing and their chests get these weird angles and they breathe hard. So the question is, are they breathing hard and for some reason, and they're sucking their chest into a strange shape because the chest wall changes shape so fast in a newborn? Or are they laying on a flat surface and they're causing the chest wall to become flat and therefore they're having a hard time breathing? I think there are probably multiple causes for chest wall defects and we don't understand them very well. I would love to see somebody study this. So if you know a graduate student that wants to do this, I think it'd be a great project. I don't think we know enough about it. I do put them on egg carton foam mattresses if they start to have problems. Some people hobble the legs, some people will do a surgery. If you can support them until they can start to get up on their feet a little bit, they'll many times return to normal, but some end up with so many respiratory problems that you just can't even keep them going. It's very tragic.
Anne says, you mentioned that parasites can cause bitches to resorb puppies. What other things can cause a bitch to resorb puppies, and what sort of things can you do to prevent this?
Sure. So it can be nutritional. It can be cystic endometrial hyperplasia. There can be infections in the uterus, both viral and bacterial. It can be stress. There's a lot of reasons that bitches resorb. Up to 30 to 40% of puppies that are conceived probably resorb. So it can be a really difficult thing. I mean, we've had bitches resorb entire litters. Just had one a couple of weeks ago. Saw 3 puppies on the ultrasound and went in for the puppy count x-ray and there were no puppies. So there's a lot of reasons that bitches can resorb. In humans, up to 1/6 of pregnant women end up losing a baby. So it's a huge number even on the human side, where we have great nutrition, great prenatal care, all those things that are going for you. Sometimes it just doesn't go the way it's supposed to. Sometimes it's a genetic defect. That the puppies just weren't meant to be normal and the bitch resorbs them. Herpes virus is probably a bigger cause than we really understand. I have a long list of things that can be the cause, but it's very difficult to chase them down. In cattle, where we have a lot of money, in dairy cows, there's a lot of money thrown at diagnosing why cows lose their calves, because without a pregnancy, we don't have milk. Without milk, we don't have a product. So there's a lot of money thrown financially at the dairy cows, and only 35% of those end up with a diagnosis with an abortion. There is a canine abortion panel blood test that can be run at Cornell. So it doesn't necessarily just have to apply to abortion. It can be resorptions. It can be unsuccessful pregnancies for any reason, puppies that die prematurely. So that blood panel can be run by a veterinarian that draws the blood and sends it to the Cornell Diagnostic Lab at the vet school. So if you look up canine abortion panel, you can have your vet submit that sample. So there's diagnostics you can do, but most of the time we don't figure it out.
And we do have probably time for one more. We have quite a few questions around feeding bitches and when you should be changing or not and stuff. So I'm just going to read out one that kind of encompasses. Vivian asks, when do you change the bitch's food to the 30-20 you mentioned? After breeding, before breeding, and how long after whelping do you continue, or can you change back to her regular food?
Those are really good questions that cover a lot of ground. So I like to put the bitches on the 30-20 diet before they come into heat. I think nutritionally we need to have them at a great plane. And we know a bitch that after she has a litter, it takes her 8 months nutritionally to get back to where she was before the litter. So you can feed that 30-20 diet for an extended period of time as long as she doesn't get too fat. So I feed it until at least 4 weeks after weaning, because it takes those bitches a long time to change their metabolic rate and get back to where they're putting weight on and starting to look good and their coats are back in. So I look at coat, I look at body condition, but yes, start at 6 to 8 weeks before she's due to come into heat. Expect a nice heat cycle, get her bred, and then keep it on until her body weight, body condition, body coat look better again. So, different, if she has one
It's
puppy,
8 o'clock.
she may not have as much of a nutritional depletion as if she has 14. So every case is a little different.
Perfect. Okay, thank you. Sorry, I'm just looking at the question count and we still have probably about 70 of them in there. So hopefully we were able to kind of summarize the main ones. If there are very specific ones, we are going to pass them over to Dr. Greer so that she can reach out to you afterwards. And other than that, that's going to be it tonight for questions. I want to say thank you so much to Dr. Greer. Thank you to everyone tonight for joining and participating. Thank you again to Purina ProPlan for making tonight possible. And for everyone attending, if you want to see more of these types of webinars, if you have any specific topics in particular you want to talk about, please reach out to us, myself at the CKC or your Pro Club membership team, and let us know.
Yeah, this was a lot of fun. So we had a lot of people attending. That's great. I'd love to do this again.
For sure, we'd love to have you. So on that note, I think it's 8 o'clock your time. It's 9 o'clock our time in the Toronto area. So thank you everyone for joining us.
Good night, everybody.